Hello, my name is Vincent Van Antwerp, and welcome to the PCM Crisis Certification Training course. During this course, we will cover all of the material required for you to become a certified practitioner in the professional crisis management system. Now, this training will take place in two parts. Part one is going to be these video modules, of which there will be 7. Which will cover all of the material in your training packet, which you should have in front of you. The second part will be in person. This part will require you to interface with me or another certified trainer in order to review this material as well as practice the physical techniques to proficiency so that way you can demonstrate them effectively. Let's get started. Go ahead and pick up your training packet. On the back side, you should see a blue piece of paper. And the text should look just like this. This is the licensing agreement. Go ahead and take a few minutes to read through this, and then hit play when you're done. Okay, great. Just as a quick review, this licensing agreement is your acknowledgement that you understand that you are being given one copy of the training packet for your use and your use only, not to be copyrighted or shared with others. Additionally, you acknowledge that you are free of any physical injuries or difficulties that would make it such that you wouldn't be able to appropriately and adequately demonstrate the physical crisis management procedures that you'll be learning in the physical portion of this training. It's important that you're able to do those without any kind of physical limitations, such that if and when you need to use those with one of your clients, it doesn't result in your injury or theirs. All right, let's get started. You'll also see a green sheet in there. We'll come back to this later, so keep an eye out for that, but know that we'll cover that later. All right, let's get into it. So before we get started, I want to teach you a little bit about how the book works. So go ahead and open that up and go ahead and fill out the application. It'll ask for your name, certification number, and the information for the company that you work for. Additionally, turn that page over and you should see a copy of the licensing agreement. Go ahead and sign that and put today's date at the bottom. Go ahead and resume this video as soon as you're done. Great. If you're done, go ahead and meet me on section 1, page 1. You should see a gray bar at the top that says Professional Crisis Management, section 1. I'm going to give you a little breakdown of what the study guide looks like and how to use it correctly to maximize what you get out of this training. First thing, on page 1, section 1, you'll see there is a bullet point outline with Roman numerals, starting with Roman numeral 1 about the Professional Crisis Management Association. Now if you go ahead and turn the page, you'll see that same bullet point with some text filled in. Each chapter has a bullet point outline at the start to show you the organization of the information. And then the chapter follows that same outline with the necessary information. Keep that in mind because it's going to be important later. All right, now do me a favor and hold that page and then go ahead and skip back towards the back, section 1, page 14 and 15. You should see at the top of the page it says study guide questions, and you'll see 5 of them on the 2 pages. Each chapter has study guide questions. Pay close attention to these because these will be your study guide excuse me. These will be your test questions at the end of this course. Again, these will be your test questions. So at the end of this training, you will have at least 80% of the questions that you will be asked on the test. And yes, it's multiple choice, but not open book. So keep these in mind. So let's go back to section 1, page 1, or 1-1 as I'll refer to it. Go ahead and turn the page to 1-3 where we start the actual chapter. And you'll see the very first paragraph says as follows, that the Professional Crisis Management Association is what? A private organization that provides training in crisis management as well as regulates the system called PCM. Now if you see, those texts are in italics. Now this is to alert you that this is one of the answers to your study guide questions. So go ahead and take a second now, turn back to page 1-14 and fill it in. Question 1, identify the company that provides training in crisis management and regulates the system of PCM. The answer is the Professional Crisis Management Association, or PCMA. This first paragraph on the slide. So go ahead and fill that in. And keep careful watch as we move forward through these modules for any italicized print. This lets you know that you found another study guide question. All right. So let's talk a little bit about PCMA. PCM is a system, obviously, that provides this training. But PCM is more than that. PCM is a comprehensive system, not a treatment system, that allows practitioners to provide an increased level of safety and support for our clients while maintaining the safest possible environment. As practitioners of PCM, we're guided by a set of ethical principles, emphasizing the importance of individual choice, human rights, and personal safety. Now, one of the things that sets PCM apart from many of the other systems is that it was created by a behavior analyst, somebody with extensive experience in the science of behavior and its application. This individual was Neil Fleissig and Dr. Merrill Winston. Between the two of them, have over 50 years experience working with crisis in various settings. Now the important thing for you to know, other than this, is that this system was designed by people who understand the science of behavior and have created this system with those scientific principles in mind, so that way you and your client are as safe as possible while you're providing treatment. Next we get into the why. Why PCM? Why is it important? As you'll see here, PCM is designed to successfully manage dangerous and crisis behaviors, and to do that with safety and dignity. PCM has 4 primary strategies in which we will do that. The first is crisis prevention strategies. This is where we teach appropriate replacement behaviors for some of the problem behaviors, and we also teach social and life skills, so that way the person effectively has skills that they can use rather than resorting to problem behavior. Next is crisis de-escalation strategies. And this is the management of what we call non-continuous behaviors that may be disruptive, self-injurious, or aggressive. Next, crisis intervention procedures. This is our hands-on strategies. This is where we would physically manage an individual in order to stop and create a safe environment when we're seeing continuous problem behavior. So, compared to the previous condition, behaviors were non-continuous, of a disruptive, aggressive, or self-injurious nature. Crisis intervention procedures are used for when the behavior is continuous or not stopping. We'll talk more about that in the slides to come. Last but not least, post-crisis strategies. This is where, once a crisis situation has been managed successfully, this is where we reintegrate the individual into the current programming. So once they've calmed down, once problem behavior is no longer occurring at a dangerous level, then we would bring the person back to programmed activities. And then hopefully get them back to working on prevention strategies, teaching social skills, life skills, and whatnot. Now, it's important to recognize that while we do teach physical management skills and we want to be able to use them effectively, PCM's emphasis is always on prevention strategies. And that's because the crises that we prevent, we don't have to physically manage. And I can't think of a time where anybody's gotten injured using non-physical strategies. Moving on. Let's talk about why crisis management is necessary. Likely, you work in a job where clients have a history of problem behavior, whether it be aggression, hitting, kicking, biting, spitting, self-injury, such as head banging or scratching or maybe eye gouging, or various litany of disruptive behaviors like screaming or swearing or doing things like that that make individuals around uncomfortable or disrupt the environment. Crisis management is necessary because we understand that these situations occur, and instead of hoping that they don't, we have to hope for the best but plan for the worst. And that means teaching strategies to deal with these situations, even physically, in order to keep everybody safe. Some things you should know about PCM. First, PCM has a long history of working with organizations and families in order to help provide treatment more safely. As we said before, PCM has been around a long time. At this point, more than 35 years. And is the summary of two individuals with extensive experience working with severely aggressive individuals' behaviors at home and in organizational settings. And this training is designed to help you do the same. PCM has an extensive track history of successful crisis management. So this system is based on the science of human behavior, which includes data collection. We know these procedures work. And last but not least, PCM addresses a wide range of behavior, from highly productive and adaptive to highly aggressive and disruptive. So while we do teach physical management procedures, that's by no means all PCM does. And that's important. Now, as far as this training is concerned, PCM limits its application to school-age individuals or individuals with special needs. This is not necessarily something that you would want to employ with friends or with individuals out in the community. If somebody's doing something dangerous, it's best for you to get out of there if you can, or call the authorities instead of deal with it yourself. As you can see here, there's a number of exclusions where PCM is not currently evidence-based and won't be used. Next, as I had mentioned previously, PCM is a crisis management system, not a treatment system. It's not a standalone system and shouldn't be used as such. As such, PCM should be used in conjunction with current behavior plan, treatment model, and curriculum for teaching appropriately and pro-social behaviors. PCM works at keeping crisis at a low level by ensuring the safety of the individual and staff providing services. in order to maintain academic and clinical gains. So, most importantly, PCM is designed to complement your current system, not replace it. And nothing that you'll be learning here should contradict what you'll already be putting in place as a result of your existing behavior plan. So, as PCM is based off scientific principles, one of the most near and dear to us behavior analysts is operational definitions. After all, how can we deal with something if we can't accurately define what we're talking about? So, PCM defines crisis behavior as one of the following behaviors: continuous aggression, self-injury, or high magnitude disruption. And you can see examples of that here. I'll give you a minute to read over these. The important thing here is that crisis is defined as continuous dangerous behavior. And as I tell individuals in my training, this typically means that the behavior won't stop unless you do something about it. And the idea here is physical management during these times prevents further injury to the client, yourself, or others. So it's important that we get in there and that we manage the behavior effectively so that way we can prevent injury. For those of you who like memory devices, here's one: cache. C is for continuous, A for aggression, S for self-injury, H for high magnitude disruption. So what is the PCM definition of a crisis? Cache. And that stands for what? Hopefully you're saying it out loud. All right, let's move on. When we're dealing with physical management of behaviors, it's important to avoid coercion. Now, as far as this training is concerned, coercion refers to the force used to control or stop a behavior. And there's a variety of different ways that this can be used. Censures, indirect threats. This may look like something like, are you going to do it or am I going to help you do it? You can also see commands. You need to do that right now. Direct threats. If you do that, you're going to lose blank. Or other types of direct punishment or physical force. Physical force could mean physically or moving an individual in an awkward, uncomfortable, or even painful position. These are things we want to avoid at all costs. Now, it's important to remember that we don't want to force anyone to do anything that they don't want to. And sometimes doing that can be perceived as coercive. Now, some trainings will teach you how to maximize coercion, and some will minimize. This is one of those. Now, it's important to remember that based on the literature and the data, we understand that crisis systems that rely heavily on physical coercion and threats and punishment tend to be much, much less effective. We see that in our current policing system, which is based on fear of punishment, right? Why don't you run the red light? 1, because you might get injured, or 2, because you might get a ticket or arrested. So in this case, the system is designed such that we behave according to rules to avoid punishers. Now, if we were to get, let's say, arrested or something like that, you may experience some physical procedures, such as leaning over a car and putting your hands behind your back that can be awkward or uncomfortable, and maybe even painful, which cause you to struggle or try to right yourself into a more comfortable position. This could be referred to as counter-coercion. And this is problematic because oftentimes this results in further physical force and eventual injury. Now, some crisis procedures may look something like this. Here's an example of an individual holding somebody's arms behind their back, maybe to stop them from being physically aggressive or hitting themselves in the head. Now this is problematic because, as you can see here, the individual's arms are hyperextended in an unnatural position that may cause them to struggle in order to avoid that discomfort. And holding someone in that position, were they to continue to fight, will likely result in your injury, theirs, or both. Here's another example. In this case, the individual's arm is pulled backwards. Maybe the person was trying to run away and the person was trying to stop them. This could potentially result in injuring the person by dislocating their arm or other injury, maybe slip and fall. And here's another one. Maybe you've seen some of these before. All of these are problematic because they significantly increase the risk of injury to the person. And as individuals in a helping profession, the last thing we want to do is injure any of those under our care. So what does PCM do about this? Well, PCM system minimizes coercion by maximizing natural body positioning and painful physical holding. As you can see here, PCM requires the use of natural body positioning during all holding, immobilization, or transportation procedures, such that the entire time physical procedures are done, the person is in a natural and comfortable position, minimizing counter-coercion or aggression in order to avoid the procedure. The two procedures that these are employed is transportation and horizontal immobilization. As you can see here, transportation involves moving someone from one place to another. Immobilization involves holding the person in one place, in this case, on a safety mat. So, at this point, we understand that counter-coercion is a bad thing, and we want to avoid it as much as possible. So, PCM teaches different strategies to allow you to appropriately match the level of intensity of the individual so that that way you can always be implementing the least restrictive procedure that will allow you to safely manage problem behavior, whether it be a non-physical strategy, asking somebody to do something, or a physical strategy, using transportation to escort them from one place to another, because that place is either prompting problem behavior perhaps, or it would be dangerous for them to remain there because of their current behavior. Now, one of the things that people always ask when we talk about physical procedures is, isn't that restraint? And I tell them, well, it is and it isn't. Here's some differences that I think it's important for us to address. Restraint typically means holding an individual to prevent continued display of crisis behavior. Now, physical procedures that we do meet that definition. However, what makes PCM procedures different is the integration of feedback and shaping into the procedure. We don't just hold the person and wait for them to stop doing whatever they're doing. Feedback is integrated into the procedure so that that way the individual is able to know through the way that we hold and the intensity what they should be doing and what they shouldn't be doing, which results in a shaping procedure or repeated reinforcements of small improvements, in this case calm behavior. As they remain calm, the holding procedures become less and less, such that the person is eventually released. And within the PCM procedures, that can happen within 12 seconds. Now that can be a game changer in terms of helping somebody learn how to quickly and efficiently keep themselves calm in order to avoid being held if that's what they'd like. From the practitioner standpoint, this means that the person will quickly and efficiently stop engaging in crisis behavior so that that way you can continue your treatment. As I said before, PCM is unique in many of the crisis intervention procedures because of its application of the science of behavior, or applied behavior analysis, in its procedures. As you can see here, there's a number of different ways in which PCM applies the science of human behavior in order to provide effective intervention tools for you, so that that way your clients get the most out of treatment and you're able to decrease the likelihood of their injury, or yours, or someone around. Now, as far as alternatives to PCM, I think we can all agree that no system is sufficient at this point to handle all crisis situations. So, as we said before, this system is going to be specifically designed, is going to be specifically applied for you working with your clients with intellectual disabilities, whether they be children or adults. It's important that you recognize that PCM is a management system of crisis and not a treatment system, and so should not be used in isolation or taught in an a la carte manner. PCM should always be practiced in the following guidelines. First, you should only practice PCM if you're a certified practitioner. Second, as part of becoming a certified practitioner, it's important that you learn and use the proper PCM terminology. Next, you should apply all of the PCM techniques and procedures in a standard fashion, as well as maintaining a safe and comfortable environment for yourself and for the clients you serve. Now, this could mean removing dangerous objects from the environment, such as if you're working on somebody learning how to make a simple meal, and on occasion they can become aggressive, maybe having sharp knives around is not the best idea. Next, the environment also should have sufficient space in order to carry out said activities. It's hard enough to learn a new skill without having the space to be able to do it appropriately. In addition, let's talk about you a little bit. Take a look at what you're wearing right now. Is this something you could work in? If not, what would that look like? I like to tell my trainees to dress tactically. Now, what that means is that you should be professionally dressed but comfortable. Your clothing should allow you to do your job better, not hinder it. Here are some things that PCM practitioners are encouraged to wear. Long sleeves, comfortable jeans or pants that stay up, shoes that allow you to squat, run, and move around, and clothing that doesn't easily rip, dries quickly, and allows you to bend over or work without having to worry about somebody seeing down your shirt or seeing something you wouldn't want them to. Some of the things you should avoid is clothing that's too tight or too loose. Clothing that's too tight might rip, or clothing that's too loose may get caught on something. These are just some possibilities. As well as accessories such as necklaces or earrings or ties or those lanyards that people wear that have their name badge on there. All of those things can be used to injure somebody by pulling on it, or it could get caught on something. And this creates a hazard for you and makes it more difficult for you to do your job. In addition, long fingernails that might be pointed could potentially scratch somebody. Those should also be potentially avoided. And last but not least, hairstyles. I always suggest people do like me and just shave their head. I say, hey, look, it looks great. You should try it out. It's low maintenance, and men and women both can look really great with a shaved head. But if you're not ready to do that yet, I suggest having a hairstyle in which you can bring your hair back in a ponytail, put a hat on, or something like that. Because if you have an individual who may pull at your hair, it's important to have that out of the way. All right, so you want to become PCM certified. One of the things that you're going to need to know are, what are the types of practitioner? Well, there are 4 types. First is the basic practitioner. Next level is practitioner. Then practitioner 1 and practitioner 2. Practitioner 2 has different certifications, P, S, or PS, referring to the horizontal immobilization taught. P stands for prone, S for supine, and PS is someone who's trained to do both. Now, if you take a quick look here, you can see that each practitioner requires additional training time. Basic practitioner is only 6, while practitioner 2P is 18. Oh, my mistake. Point of correction. The practitioner 2 level is actually 22 hours, not 18. Now you can see on here that there are some things in common, however. For instance, all practitioner levels have to fill out an application. All have to complete a performance checklist as required for the level trained. All have to pass the written test with 80% or better, as well as take a physical exam. Now let's talk about what those practitioners are trained to do. So if you're a basic practitioner, you're trained to do only non-physical strategies. None of the physical training procedures are taught in the basic course. Now likely if you're watching this training, you'll be certified as a practitioner level. As a practitioner level certificate, you will be authorized to use all PCM non-physical strategies as well as personal safety and transportation procedures. At the higher levels, they maintain all of the same certifications as well as vertical immobilization for practitioner 1, you'll see that at the end, and horizontal immobilization for practitioner 2. Again, you'll see that at the end. Now, once you're certified, it's important that you maintain your certification in good standing. One, for your safety, as well as for legal guidelines. Just like you wouldn't drive a car without a license, it's important that you don't practice PCM techniques or strategies without certification. Now, you may ask, well, when do I have to recertify? All PCM certifications expire in 12 months. So that means that they require you to recertify once a year. Certification begins on the last day of your training. So for those of you attending here, this will be when you complete your physical training with me or another instructor. That's when the clock starts. However, PCM allows a 90-day grace period from the annual certification date in order to complete a recertification course. Now this grace period extends both before and after your certification date. So, for instance, let's say you complete your certification on January 1st. That means you have 12 months, so you need to get recertified on January 1st the next year. However, you can get certified up to 3 months in advance, so October 1st, or 3 months after. Now you're also able to request a 30-day extension. So for instance, let's say it is coming toward the end of March and you're not able to recertify in time. You can email PCM at pcm.com and request a 30-day extension. That needs to be done before your expiration date, which would be April 1st. If that's done, you will get an extra 30 days. And here's the email again. Keep in mind, this needs to be done before your certification expires. If you wait until after, unfortunately, you'll have to take the training all over again. Now that we've talked about when recertification has to happen, let's talk about what it looks like. Now, if you remember from the previous slides, practitioner level requires 14-hour training. Whereas recertification, as you see here, only requires 7 hours. So while the first training may require 2 days, retraining only takes 1 day. Now, similar to the initial training that you'll be completing today and at a following date, you have to meet the hourly requirements. You have to complete a recertification application, as you just did a little bit ago. You have to complete the required reps on the performance checklist, and you have to pass the written exam and the physical exam, passing all of the critical items. Critical items are listed on that green sheet that we talked about at the beginning of this training, but we'll get back to those a little bit later. Keep in mind that PCM reserves the right to revoke your certification at any time if you were to engage in any of the following problematic behaviors, such as improper use of PCM procedures, any violation of ethical standards, or any substantiated charges of physical or sexual abuse. And that's because the individuals who are certified and practice PCM are an elite bunch of individuals who have put in the time and effort to make sure that we are caring for the individuals in our charge at the best of our ability. And it would be unwise for us to allow people to practice PCM if they're not doing it correctly, or if they've been found to cause pain or discomfort to others inappropriately. Now remember, PCM's procedures and materials that you have are all copyrighted, which means that you shouldn't be transmitting them, reproducing them, or sharing them. Those types of things can lead people to try procedures without the requisite training, which could result in injury to themselves or others. And as one of the tenets of PCM, safety is our highest priority, so we wouldn't want that to happen. And so as a practitioner of PCM, it's important that you follow the standards. This ends Module 1.